The EquCellpen is a medical cold plasma source and is suitable for the treatment of a variety of diseases in daily practice. Clean the EquCellpen and the electrode with disinfectant before and after treatment. Various electrodes with differently shaped contact surfaces are available for the EquCellpen. The therapy guide helps you to decide which electrode and which setting to choose. Before inserting the electrode and the battery, make absolutely sure that the amplitude rotary switch is in the off position. Insert the electrode all the way into the EquCellpen as far as it will go. Depending on the indication, the pulse frequency can be varied using a rotary switch between 10 and 100 Hz. At frequency setting 10 first dot, a special function is programmed on the latest generation devices, with which the device automatically modulates up and down from minimum to maximum, both in terms of amplitude and frequency. With this setting, the amplitude rotary switch only switches on/off. This special function is suitable for trigger points or areas of hyperesthesia, for example. The amplitude rotary switch allows the output power of the device to be regulated in 9 stages and thus determines the intensity of the therapy. First, select the frequency according to the indication. Use the amplitude rotary switch to adjust the device and determine the intensity of the treatment. Always start with amplitude 2 to 4 to get patients used to the therapy, and as soon as the animal has got used to it, switch up to the desired amplitude. Always hold the pen behind the marking line to ensure the best power output from the pen. Place the pen directly on the skin and let it glide slowly over the treatment area without breaking contact. The basic rules for electrode selection and therapy times are as follows: 60 to 90 seconds per treatment area under the electrode at the highest amplitude. Always move the electrode. With a lower amplitude, the therapy duration must be extended according to the lower amplitude selection and thus reduced power. The treatment time required can be estimated by comparing the area to be treated on the patient with the area covered by the electrodes. With the disc, it is exactly the area of the electrode that counts. For the straight or curved electrode, with the tip applied, a circle with a diameter of 15 millimeters should be used. When the electrodes are placed sideways, the covered areas increase accordingly. The different shapes of the electrodes allow the best solution to be selected. If you wish to go beyond the disinfecting and stimulating effect,
for example,
to dry out and debride an oozing or hypergranulating wound with astringent application, the application time can be extended under visual monitoring of the effect on the tissue. With enough treatment time, the wound will look less wet and therefore more matte. Granulation tissue indicates cell inhibition by a change in color from red to grayish. The operating time of a battery is approximately 30 to 60 minutes, depending on the settings selected. The LED flashes green when the battery is discharging. If the LED lights up red, the remaining time is approximately 10 minutes.